Welcome back to Western New York Living. No parent ever wants to hear that their child has been diagnosed with a life-threatening illness. And if you're a parent looking for somewhere to turn, then Hospice Buffalo is here to help with their Essential Care for Children program. They are a team of compassionate pediatric professionals specially trained to work with children and adolescents at home. And joining me now to tell us more about Essential Care for Children's program is Debbie Powers and Greg Ryan. Thank you both for being here today.
Thank you for having us.
Debbie, let's start. What is Essential Care for Children?
Essential Care is a supportive care program. We work with children that have life-threatening or life-limiting illnesses, and we work with those families to help manage symptoms with those children. We try and keep them out of the hospital as much as possible. We really do a lot of advocacy to help ensure that they get the equipment and the supplies necessary in the home.
Now, this program essentially has 3 areas that it works with.
Correct.
Explain those.
We have a perinatal program, and in that program, our nurses work with the expectant mothers whose unborn child has been diagnosed with a life-threatening or life-limiting illness. That baby might not survive to term or may die shortly after birth. Then we also offer hospice services to our pediatric patients. And the goal of hospice, when treatments have failed and curative options are not available anymore, we work with those families to provide supportive care and end-of-life care and ensure that the children are comfortable and their families are supportive.
And then you have the palliative care?
And then the bulk of our program is the palliative care. People always assimilate palliative care and think of end of life, but the palliative care program really works with children that are living with chronic illnesses, and again, helping to manage those symptoms and make the quality of life the best it can be for those children.
Now, how are these services different than what a pediatrician or a children's hospital might offer?
So our Essential Care program is all home-based services. So not only are the nurses in the home, but the social workers, as well as our team of expressive therapists, our massage therapists, as well as music therapist, and then our art therapist also works with not only the child, but with the parents and siblings as well to offer support.
Now, who do you work with within the healthcare community?
We have a large field of resource. We work with physicians, certainly pediatricians, but also Children's Hospital we partner closely with. We work with their lung center as well as their pediatric intensive care unit, their neonatal intensive care unit, and with Sisters Hospital as well, their neonatal intensive care unit.
Now, Greg, I'd like to bring you in here. Father of Connor, a former Essential Care for Children patient. What made you reach out to Essential Care for Children?
Actually, my mom is an essential care nurse.
Okay.
So early into my son's diagnosis, he was diagnosed with a heart condition. We brought him into program where we got set up with the social work end of it, which trying to figure out how they set up some of the financial stuff, as well as we got to meet with a nurse, Debbie, who's here with us today. She actually was my son's nurse, and they got him set into the program and helped us where she looked over his charts and different stuff like that very early into his diagnosis and whatnot of what he had. From there, he was in the hospital for almost 6 months before there was nothing else left we could do, the doctors could do anymore. At that point, we got to bring him home, and that was the best 6 days of our life. It was he suffered for a long time, unfortunately, but when we got him home, we got to do normal stuff with him. We were able to take care of him, and they set all that stuff up. I left the hospital by ambulance. They got us an ambulance at the hospital, drove us back to our house, set us up, had all his oxygen machines, all this equipment to take care of him at home. So we got an awesome 6 days. It was the best part of all of it. With that, I took him on walks. We had music therapists come right into the house and sing songs with my daughter, who's younger as well. My daughter got to give him a kiss goodnight every night, and it was incredible. It really was. I mean, it was hardest thing I've ever been through in my life, but I will say they made it super easy and made it very comfortable, and it was great for Connor. He was able to pass peacefully.
Well, sorry for your loss, and we do thank you sharing your experience, though, with those
I hope we can help more, because I think there's a lot of parents, there's a stigma sometimes around it that they don't want to talk about it, and the reality is there's when you don't have any more choices, you got to do what's best for your child, and this was the best for Connor.
Yeah, well said. Thanks for being here today. Hospice Buffalo Essential Care for Children program provides the most comprehensive home-based care to children with life-limiting illnesses. Their offices are located at 150 Bennett Road in Cheektowaga. For more information, give them a call today at 686-8006. You can also visit essential-care.org to learn more about this program and all the services they can provide for your child and your family. Now, coming up in our second half hour, if you're having trouble hearing the TV or maybe conversations, Buffalo Hearing Evaluation Services of Buffalo can help. They'll be joining us to discuss the latest technological advances in hearing aids.
Special consideration for today's show paid for by the following: